Yes, once we've established a diagnosis of cervicogenic headache, there are a lot of different types of treatment that we can use in the office that will help the patient. Our initial objective is pain management because people come to us in pain. And the types of treatment that we use, the most common is cervical manipulation or adjustment, and that's designed to reestablish the normal flexibility of the joints that are contributing to the soft tissue irritation. We will also bring our patients back to our therapy department and use pain management treatment, ultrasound, electric muscle stimulation. As they improve, we have a staff of medical massage therapists that will also be involved in the treatment of the patient, and they deal with the areas of tenderness that we talked about, the trigger points, the adhesions, and muscle spasm. Now, as a patient improves, we also look at home exercise programs. We want to improve the posture. We want to improve the strength of the cervical spine to produce a long-term benefit from care. The joint manipulation or adjustments are what we use to reestablish the mobility of the cervical spine or neck. TAVR-refractory care is very safe. The manipulation or adjustments that we do are gentle. They do not compromise the vascular components of the neck. And the clinical outcome is very good. Patients are surprised at how painless the treatment is in the office. We have seen an upsurge in the cervicogenic headaches since the onset of COVID, because a large percentage of people are working at home now, and the work ergonomics at home are usually poor. So if a person is sitting at a computer for extended periods of time, we want to make sure that the height of the monitor and keyboard are appropriate, so we minimize the recurrent strain when they're doing their job at home. Pillows are important. We want the patient to be able to sleep in a neutral posture. We want their head, shoulders, and back to be in a good alignment. We also talk to patients about not sleeping on their stomach, and either on their side or on their back is the preferred position. The preferred position for sleeping with neck pain and headaches is either on their side or on their back and not on their stomach. As I said earlier, the cervicogenic headaches don't do well with over-the-counter medication. And when patients do take a lot of over-the-counter medication and then they stop taking it, there's often a rebound effect. So the long-term benefit of drugless treatment with headaches produces a better prognosis and a better long-term outcome. Studies have shown, and in our own clinical experience here in the practice, that the treatment that we provide to the patient cuts the number of symptomatic days in half, and most patients within 2 weeks show a significant improvement, usually around 50%.